And then for the next story, as a part of work to make sure they come out to malaria, patapata for inside the Nigeria and Africa, some kind sabi people on top of the matter don't gather for Abuja for this year's seasonal malaria Chemoprevention Alliance meeting. This meeting so different people from Africa they come, maybe follow contribute much for the matter. Inside the talk, we say they can't talk now. Now there will be say the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, he can't talk now. So this meeting not to fit guide we country. Follow plus to make sure they touch light every way concern how they go take solve this wahala of malaria, and say they go take discuss all the wahala what they face, all the lesson what they learn, bring out a solution and every for this matter. Person represent the minister, now the director of public health for inside their ministry, Dr. Chukuma Anyike. Now they will say they call all our sabi people we get out and leg for top this matter, both for Bodo Ibo, so may they no dolo, may they still continue for their support they give to end the malaria. Make we hear.
There is no doubt SMC implementation has attained a major milestone since the WHO recommendation over a decade ago, and its deployment has been shown to be impactful, feasible, and highly acceptable malaria prevention intervention. The government of Nigeria has long adopted the seasonal malaria Chemoprevention as one of these drug-based malaria prevention strategies in 2014 and has truly demonstrated remarkable, unprecedented, and dogged approach at implementing SMC over the last 10 years. Nigeria commenced deployment. The initial pilot conducted in Katsina State, one of the states in the country, in 6 local governments, which is equivalent to districts in some of the country. I want to call all global stakeholders not to relent on their efforts towards this impactful intervention, which will contribute significantly to the drive at eliminating malaria in endemic countries.
For your own side, the assistant chairman for inside SMC Alliance, Dr. Perpetua Uhomoibi, he can't talk now. Say malaria is still one of the number one thing where they kick children when never reach 5 years from inside Africa. So, and so they get plenty work to do to fit end the spread of that malaria.
It's still definitely an issue in Africa. It is the number one cause of death among children under 5 in most of the endemic countries in Africa. And that has changed a lot in the last 15 or 20 years in terms of the numbers of deaths have gone down because of interventions like SMC. However, it still remains a major cause of morbidity and mortality, and we still have a lot of work to do. That's why we're very engaged in implementing SMC.
Still the National Malaria Eradication Program focal person, talk person will be Emmanuel Shekarau. He said there's still a work to make sure this malaria vaccine at least you go reach in Nigeria to make our people for take make we hear as in for take yarn.
Yeah, the malaria vaccine was piloted in 3 countries before the eventual recommendation issued by the World Health Organization sometimes in 2021, I guess, October 2021. And so those countries have helped in providing the necessary evidence required to see the efficacy of the vaccine, which is promising, but however, has to be deployed alongside other interventions such as seasonal malaria chemoprevention, because it's a vaccine, but it's not 100% efficacious in protecting children against malaria. So currently, those countries that piloted it have received support to continue with the deployment of the vaccine, while other countries such as Cameroon and a few other countries have also commenced accessing this vaccine. Nigeria is on track in ensuring we access this vaccine, but currently it is not yet deployed in country because we are still waiting for support to have it available and accessible in the country.
Other countries will be say show face for inside this year meeting follow for Cameroon, Ivory Coast, Benin Republic, Ghana, Mali, Burkina Faso, Niger and Senegal. Others now Gambia, Madagascar, Guinea-Bissau, Mozambique, Chad, Mauritania, South Sudan, Uganda and even Kenya follow for the matter.